Hello, this is Molly Williamson, and this is my lower extremity skill check. Before we get started, I just want to remind everyone of the signs and symptoms of a deep vein thrombosis. And this is something that you would notice if maybe someone has a calf that's really swollen, is maybe red, warm, painful, or tender. Then that could be signs that they have a blood clot in their leg, and this is a medical emergency. So you need to stop exercise right away and get that person medical attention as soon as possible, because you don't want that blood clot to maybe travel to their lungs or to their brain where it could be fatal. So it's really important to be aware that if you do see those signs and symptoms, you get that person medical help as soon as you can. I'd also like to talk about some other precautions after surgery. So after someone's had an ACL surgery, you want to make sure that you avoid certain types of exercises. So you want to make sure that you avoid exercises in the early stages of recovery, where someone has their foot off of the ground and their knee is bent in the 15 to 45 degree range. So you definitely don't want to do an exercise where you have an ankle weight and you're having them bring their leg up and down within that 15 to 45 degree range, because that's not going to be a safe exercise for them with that ligament that's just newly recovering, because that puts a lot of stress in that area. Another exercise type that you want to make sure you avoid are exercises in where the patient has all of their weight and they're on their feet, and then they're bending their knees in the 60 to 90 degree range. So you don't want to be doing deep squats or anything like that while the patient is recovering until you get to the much later phases of recovery. Because even past the initial stage, even in that moderate protection phase, these kinds of exercises just put a lot of stress on that healing ligament. So you want to hold off on those until much later. And today we're also going to be talking about medial meniscus repair. So for patients who've had that surgery, the precautions can vary a little bit. So sometimes surgeons or physicians might allow a patient to be full weight bearing as long as they are wearing their brace locked with their leg fully straightened. And sometimes the patient might not be allowed to bear weight at all for the first 6 weeks. So it kind of depends. And sometimes they might be allowed, when they're not wearing the brace, to bend their knee as much as they're able, but sometimes they're not allowed to bend it more than maybe 90 or 100 degrees. So it's just really important to be aware of what the precautions are from the surgeon or the physician, and always make sure to ask about those if you're not sure what those are. So those are some precautions that we should be aware of. Now I'd like to show you an exercise that you can do in the subacute stage of recovery after a medial meniscus repair. So this is called the side stepping exercise. So this exercise can be helpful just to work on controlling the hips and the knees when you're doing side to side movements. Because if you're doing a side-to-side movement and you're doing it incorrectly, that can put a lot of stress on the inside of your knee where that repaired meniscus is. So when we're working from where we weren't bearing weight, and then now we're allowed to bear weight, because you don't want to do this until you're allowed to bear weight, and then we're trying to progress to where we can do movements side to side quickly and during maybe sports or something. You want to make sure that first you can learn how to do it in a safe way before you try to do it. Do a lot of those. So to do this exercise, you start by having the person bring their belly button to their spine, hinge at the hips, and then step to the side with control, and then step back. You want to make sure that you're not bending your knee in at all during this exercise. You want to make sure that you're also not moving with your upper body, so you don't want to be reaching out to the side and leaning over to the other side, because then you're not really working on developing the control that you need. So make sure you bring your belly button into your spine, hinge at the hips, and then keep your upper body straight, and make sure you're not letting your knees come in together, and just work on stepping to the side slow and controlled. And you can definitely do this in front of a mirror, which can help you to see whether you're doing it correctly or not. Another way that can be helpful if someone's having difficulty with just not letting their knees come in is if you have a resistance band, especially a lighter one that you can just tie around would be best. This is the only one I have, so this is what I'm going to use to demonstrate, but ideally you wouldn't use a loop and you wouldn't use a heavy one, because the goal is not to make this exercise more difficult by adding the band, but if you tie a light band around the outside of the person's legs, sometimes that can help them just to feel a little more whether or not they're letting their knees come in, because you can definitely feel it in the band if you're letting your knees come in, and if you're thinking about keeping that band with a certain amount of resistance and not letting the amount of resistance change, sometimes that can help people to just be a little bit better about keeping their knees in proper alignment with the hips as they do this exercise, which is going to be really, really important when people start to play sports where you're doing any sort of sideways movement, because when you do let your knees come in, that can put a lot of stress on that inside where the medial meniscus is. So that's one exercise that you could use, and you could maybe do 2 sets of 10 stepping back and forth each way, and probably do it every other day just so that your muscles have a chance to recover. And this exercise that I'm about to show you is a really good exercise for someone in the acute phase of recovery from patellofemoral dysfunction syndrome. So this is a straight leg raise, but instead of just having your leg fully straightened with your toes pointing up, you're going to point your toes to the side and you're going to bend your knee just a little bit. And it's kind of this scooping motion where you're bringing your foot up and slowly back down with your knee bent just a little bit to about 20 degrees. So what makes this a good exercise for specifically patellofemoral pain is that having the knee bent just that little bit makes it a lot more comfortable than if your leg is fully straightened, because when it's fully straightened, that can just put a lot of pressure on the kneecap, whereas if you let it bend just that little bit, there's a little bit more space, and it's a lot more comfortable for people. And the nice thing about having the toes out to the side is that works the inside muscles of your thigh a little bit more. And one of the causes of pain in the kneecap area is often when the muscles on the outside of your leg are pulling on the kneecap more than the muscles on the inside of your leg. So if you can strengthen the muscles on the inside, it can help to balance it out and help to reduce the pain that someone's feeling when they have patellofemoral dysfunction syndrome. And this exercise you could also have someone do 3 sets of 10 every other day, depending on how difficult it is for them. If you can't do 10 full repetitions with good form, then just stick to the amount that you can do that will be challenging, but that you can do with proper form. So now that we've gone over those exercises, we're going to take a quick field trip to the other room so we can talk about ways that you would move around in bed after a knee surgery. So here we are. If you've had a knee surgery and you're lying in bed and you need to sit up and stand up and get out of bed, a lot of times people might not be able to straighten their knee all the way, so it might be slightly bent. But you can use your unaffected leg, bend that, and then also be using your hip muscles on the affected side so that you can control the leg and just slowly and gently bring it towards the edge. Make sure that you're just not letting it flop around and get twisted, but that you're just maintaining good control. And then to lay back down in bed, you can do the opposite. So just make sure you're using your hip muscles to have good control of that leg. Make sure the knee isn't getting twisted, but that it's just staying aligned in a way that's not going to cause you additional pain. And so that's just one strategy that you can use when you're moving around in bed after a knee surgery. So that was all that I had to show you today, but it's been a pleasure working with you. If you have any questions, feel free to contact me, and I'd be happy to talk with you about just ways that you can help work on your lower extremity to help it get stronger and get you back to doing the things that you love to do. Thanks. Have a great day.